Questions 321-340. 321. A mother, who is planned for the labor induction, is started on intravenous medication. She is in the first stage of her labor and is having regular and increasingly stronger uterine contractions. Her cervix is 1 centimeter dilated for the past few hours. Both the mother and the baby are being monitored. Which of the following signs should alert the midwife? A. Baby's head not engaged. B. Decreasing heart rate of the baby. C. Mother's blood pressure 110/60 mmHg. D. Mother's perspiration and increased thirst. The answer is B. Decreasing heart rate of the baby. 322. A nurse is teaching a 26-year-old primigravida who are 33 weeks pregnant on how to use a kick chart. Which of the following statements will indicate that she understands the nurse's teaching? A. Fetal movements must be counted 3 times per day. B. Fetal movements are felt best when the woman is on her right side. C. Fetal movements is a reassuring sign which indicates that the fetus is healthy. D. The kick chart is used to record fetal movement for the first time during pregnancy. The answer is C. Fetal movements is a reassuring sign which indicates that the fetus is healthy. 323. Which test should be performed to screen for cervical neoplasia during antenatal assessment? A. Papanicolau, PAP. B. Vaginal rectal culture. C. Rapid plasma regain test, PPR. D. Venereal disease research laboratory test, VDRL. The answer is A. Papanicolau, PAP. 324. A woman was diagnosed with gestational trophoblastic disease. What is the lab investigation was done to diagnose the disease condition? A. Cervical pap smear. B. Serum hCG levels. C. Serum estrogen levels. D. Plasma thyroxine levels. The answer is B. Serum hCG levels. 325. While the nurse is performing postpartum assessment for a primiparous mother delivered 2 hours ago, she found the following. Fundus level, midway between symphysis pubis and umbilicus position, at the midline consistency, contracted lochia, constantly. Which of the following is the most likely diagnosis? A. Full bladder. B. Perineal hematoma. C. Birth canal laceration. D. Retained placental part. The answer is C. Birth canal laceration. 326. A multipara mother complained of small vulva with swelling following vaginal delivery of a baby weight 3.8 kg. What is the initial nursing action should the nurse advise the mother to perform? A. Apply ice pack. B. Maintain bed rest. C. Administer analgesics. D. Encourage fluid intake. The answer is A. Apply ice pack. 327. A primigravida mother is assisted out of the bed a few normal vaginal delivery. She is taken to the bathroom cleaning herself and to pass urine. She has difficulty in commode seat and is having no urge to urinate. Which of the following intervention is the most desired? A. Teach Kegels exercises. B. Give warm sitz bath first. C. Pour warm water over vulva. D. Identify possible perineal tears. The answer is C. Pour warm water over vulva. 328. A 20-year-old primigravida who is pregnant at 40 weeks admitted to labor and delivery unit in active labor. Vaginal revealed that the fetal occiput is close to the maternal. Which of the following would the nurse expect to be increased this fetal position? A. Leg cramps. B. Back discomfort. C. Vaginal bleeding. D. Nausea and vomiting. The answer is B. Back discomfort. 329. A mother, who is planned for the labor induction, is started on intravenous medication. She is in the first stage of her labor and is having regular and increasingly stronger uterine contractions. Her cervix is 1 centimeter dilated for the past few hours. Both the mother and the baby are being monitored. Which of the following signs should alert the midwife? A. Baby's head not engaged. B. Decreasing heart rate of the baby. C. Mother's blood pressure 110/60 mmHg. D. Mother's perspiration and increased thirst. The answer is B. Decreasing heart rate of the baby. 3:30. A nurse in the postnatal ward is assigned for a multiparous patient has just delivered a healthy newborn. When should the nurse plan to take the patient vital signs? A. Every hour for the first 2 hours. B. Every 30 minutes during the first hour. C. Every 15 minutes during the first hour. D. Every 5 minutes for the first 30 minutes. The answer is C. Every 15 minutes during the first hour. 3:31. Which valuable information can be obtained from perform abdominal palpation, Leopold's maneuvers, during the later pregnancy? A. Weight of the fetus. B. Gestational age of the fetus. C. A number of fetus in current pregnancy. D. Location and presentation of the fetus. The answer is D. Location and presentation of the fetus. 3:32. A nurse who is caring for a woman in labor prepares to auscultate fetal heart rate by using Doppler ultrasound device. How does the nurse determine that the fetal heart sounds are correctly? A. Notify if the heart rate is greater than 140 bpm. B. Placing the diaphragm of the Doppler on the woman's abdomen. C. Palpating the maternal radial pulse while listening to the rate. D. Performing Leopold's maneuvers first to determine the fetal heart. The answer is D. Performing Leopold's maneuvers first to determine the fetal heart. 3:33. Blank is an abnormal form of pregnancy in which a non-viable fertilized egg implants in the uterus and will fail to come to term. The answer is molar pregnancy. 3:34. Molar pregnancy indicates blank. The answer is rapid increase of uterine growth. 3:35. A 28-year-old pregnant woman at 9 weeks presents to the OR with vaginal bleeding. During assessment, the nurse found height is 12 centimeters. Which of the following is the most likely diagnosis? A. Placenta previa. B. Abruptio placenta. C. Ectopic pregnancy. D. Hydatitiform male. The answer is D. Hydatitiform male. 3:36. A 25-year-old patient with history of amenorrhea for 2 months was admitted for hydatitiform mole investigation. Which signs and symptoms would the nurse observe? A. Hypotension. B. Hyperglycemia. C. Rapid uterine growth. D. Painful uterine contraction. The answer is C. Rapid uterine growth. 3:37. A woman was discharged from gynecological ward after gestational trophoblastic disease, molar pregnancy. Which of the following is the best advice to give her? A. Never to fall pregnant again. B. To request the doctor to sterilize her. C. To consider having her uterus removed. D. To avoid falling pregnant for at least 1 year. The answer is D. To avoid falling pregnant for at least 1 year. 3:38. Postpartum mother is to be discharged on the 2nd day of her forceps delivery. She had sutures on her vaginal and perineum tears. She is breastfeeding her baby and eating special food provided by her family. What discharge teaching needs more emphasis? A. Diet management and exercise plan. B. In newborn care and vaccination records. C. Hygiene practices and alert signs to report. D. Family planning and child growth monitoring. The answer is C. Hygiene practices and alert signs to report. 3:39. When performing a postpartum assessment on a woman, the presence of clots in the lochia. The nurse examines that they are larger than 1 centimeter. Which of the following nursing actions is most appropriate? A. Document the findings. B. Notify the physician. C. Reassess the client in 2 hours. D. Encourage increased intake of fluids. The answer is B. Notify the physician. 3:40. Multiparous mother is attending at the outpatient clinic 2 weeks after her delivery for follow-up. While the nurse is assessing the mother, She would not palpate the fundus. Which of the following is the most appropriate nursing action? A. Document normal finding. B. Massage the fundus to be firm. C. Assess lochia amount and color. D. Admit the mother to the hospital. The answer is A. Document normal finding.